Hi and welcome to your 5-minute nursing and midwifery interviews video. I'm Sophie and I'm joined by Natalie and Rosie and one of our students who is going to support us.
In this video, we'll look at how you can become the most prepared for your interviews.
There are a variety of interview types that you might be asked to attend. In this video, we'll look at the panel and multiple mini interviews.
Firstly, what's the difference? Panel interview. You'll meet several representatives who work in different roles. They'll ask you a number of questions relating to your field of study. You'll meet clinical staff, academic staff, and service users.
For multi-mini interviews, you'll likely have 6 to 8 stations, which represent the different competencies you need to meet in order to be a successful nurse or midwife.
You'll be given a different scenario per station and a time limit, and you'll need to work your way through each area, answering a question or undertaking an activity.
We want to help you as much as possible. So let's go through the sorts of things you could be asked during both these interviews.
Hi there, my name is Abigail and I'm the course ambassador for nursing here at Middlesex University. This is such an important question for you to practice answering. Why do you want to be a nurse or a midwife? What is it about this profession that really interests you? For example, you can say, I have a caring heart and I show empathy to people around me. Do give an example on what you've done to show empathy to people around you, and how has this experience influenced your decision in making nursing as a career? Now it's time to look at how much you know and understand about the role. What are some of the challenges nurses might face, and what will you do to overcome these challenges? Do you understand what a nurse does from day to day? And what are some of the skills and experience that will help you to do this job? This is where you need to give a practical example on what you've done and the skills you've gained that will help you to do this job. This is where you show off your time management skills and how organized you are. Do give an example of when you've taken part in a project in school or maybe in your personal life where you manage yourself and others to achieve a goal. It is so important to be able to demonstrate a good team working skills. You will be doing this a lot when working as a nurse. Nursing is all about working in a team and supporting each other. Think about some examples where you've worked in a team to achieve team goals and why you think these skills are so important in nursing. Take a moment to think about this question. Why do you think nurses and midwives need to have good communication skills? As a nurse or a midwife, you will be working in a team, which includes doctors, physiotherapists, dietitians, and many other healthcare workers. It is very important that you are confident when you speak and also you are able to pass on information clearly and effectively. You need to show your interviewer that you've got these skills and evidence them with examples. You need to be able to tell your interviewer why you think equality and diversity is so important in this profession. How do you think your understanding of equality and diversity will help your approach as a nurse or a midwife? Demonstrate and explain what the meaning of equality and diversity is and give examples. For example, as a nurse or a midwife, you will be working with patients from different parts of the world with different needs, different wants, different desires, and etc. You still have to give your patient the best of care with no judgment regardless of where they are from. This session is a little bit easier. This is where you get to talk about any work experience you have undertaken in school or college that demonstrates your transferable skills, or any life events that you feel have prepared you for the professional roles that you are aspiring to. As a nurse or a midwife, you will find yourself in emotive and challenging situations, which sometimes might cause you to cry or even feel so upset. Your interviewer wants to know, do you have the skills and abilities to cope in situations like this? How would you manage situations like this? Do think back to a time where you found yourself in difficult time. This could be anger, distress, grief in you or even in others. How did you react to this and how did you manage this? You will then be ready to participate in our nursing interview. We wish you luck and thanks so much for joining us. All the best.